Racing back on 500 from the town, from the state line back this way. I'm thinking, boy, this brings back a little bit.
Ooh. All right, we are being recorded just for your information. So thank you everyone for coming tonight. My name is Kim Lammers and I am the mobility manager for Maumee Valley Planning Organization. And that position is actually an ODOT grant funded position. So a lot of the things that I talk about are ODOT related because of my affiliation with ODOT, but please know, feel free to ask any kinds of questions. I'm open for questions here. So I approached the county commissioners, I don't know, maybe 6 months ago or so, and asked them if it would be okay if I conducted a study on the county to look at what are some of the transportation needs and unmet needs. So that's what we've been doing the last 6 months or so. What we created was a transportation coordination committee. And on that committee, we have providers, both for-profit, nonprofit, human service agencies. We try to think of everyone that would be a provider of transportation, also programs of transportation that like will pay, maybe they don't transport themselves, but they pay for others to transport on behalf of their clients or their population that they serve. We like to have on our committee passengers or advocates, human services partners, welcome, health providers, private industry, educational institutions, and finally government officials. We collected data. We put out public surveys back in February and tried to ask anyone who has been in need of transportation in the last 3 to 6 months, fill out that survey. And we were able to get some good feedback from that population here in Paulding County. We also, the committee members, because they are, I consider them stakeholders, the people who are currently serving transportation needs in the county, I had a survey for them and collected that data to say, who are you seeing there's a need for? And then finally, we did provider information forms. So the people who are actually giving transportation, how many vehicles do you have? How many miles do you travel in a year? How much money are you spending? How many drivers do you have? So we could kind of get an inventory of what this county actually has, and then what is the unmet need, populations of unmet need that we're seeing we need to try to help accomplish. During that, those surveys, we started a draft of the coordinated transportation plan in which I looked at also demographic data. And that includes population, race, disability, seniors, poverty or below the poverty line, just trying to see where in the county are we seeing pockets of population that might need additional help and assistance. So we've been able to come up with this draft coordinated plan that lists unmet needs, lists some goals that we can try to accomplish as a county. And we are going into this public comment period here in July. That gives 30 days for the public to make any comments, say, I'd like to see this. I think you need to change that. Just give us any feedback they see with the plan currently. And then obviously part of our public participation, we've done tonight's meeting. So unmet needs that we hit. I'm going to give you this because my PowerPoint isn't projecting and I feel bad for you. Sorry. It's not her fault, it's mine. For unmet needs, we listed public transportation being our first one because while we have pockets of transportation throughout the county with the senior center, the board of DD, veterans, JFS, everybody's serving populations, but it's all it's in silos right now. We talked about resources and funding, particularly a resource that is in high need right now is drivers. Almost every transportation provider I talk to nowadays talks about their need for more drivers. So that's definitely an unmet need currently. Education on transportation programs and providers. So I mean, I got a lot of positive reinforcement and affirmations when I showed them my website, my committee, the website of how I have all the providers and programs in Paulding County on the website so people can go there to seek out transportation. It's something we haven't had before. So, not everybody knows that many of our insurance programs actually pay for a certain number of transportation trips to the hospital or trips to a doctor's appointment. And so part of this is just educating the public on what's out there and what they have available to them as well. An unmet need is also extended hours because oftentimes those siloed groups that are offering transportation are only offering it during Monday through Friday, certain hours. So after hours, weekends are seen as a need, unmet need right now. Accessible vehicles that can handle, lower clearance, so it's easier for people to step into. Wheelchair accessible vehicles are definitely needed. And then finally, I know people don't always think of this as transportation, but it's considered transportation for MoDOT is active transportation. And that includes walking, biking, and again, looking at our communities, are they connected by sidewalks? Is it easy and safe for someone who doesn't have a vehicle to walk from one part of town to another part of town? Do we want to look at the populations that have zero vehicle households, and are they connected with other parts of that would be vital to them? So that's a possibility as well as an unmet need, is building more sidewalks and infrastructure in that way. So with those unmet need, the committee met twice actually to talk about some of our goals. And one of the first goals is just maintaining the fleet of vehicles and the services we currently have. We want to make sure that, every year that fleet of vehicles is getting older and getting more miles on it, and that we're regularly replacing them and keeping them up to date, and the county doesn't fall behind, but continues to at least maintain, if not even increase. We talked about increasing the number of individuals who provide transportation, talking about either finding ways to hire drivers, hiring staff to help coordinate transportation in the county, generally just increasing what that looks like, the footprint for transportation in the county. And finally, educating the public on transportation. And a lot of that goal was kind of utilizing my position and making sure that I show up to the advocacy nights here in the senior center and coming here and just making sure that I'm educating the public whenever I can on what are the transportation programs that your county currently has. Now, with many of our goals that we have listed here, it kind of comes down to our objective of building a relationship with ODOT, applying for formula grants that would help fund transportation programs here in the county. What we're working on is applying for a formula grant, identifying who would lead that agency. Would it be a nonprofit? Would it be the county? Would it be a for-profit? So those are the things we're kind of looking at and seeing how we can work together and who would then apply for the grant for the county on behalf of the county. So while we have a nice little coordinated plan, a lot of the work is on a roadmap in front of us. We have a long way to go until we're actually providing additional services and funds. So today in July, we're doing a public comment period. In October, my hope is that I'll be able to take these comments and final edits back to the committee, and the committee can approve our coordinated plan. That will then in November go to our county commissioners for approval and ODOT for approval. And then finally in December, next meeting in December, we'll be able to start enacting and start working on it. But like I said before, this isn't going to be just a coordinated plan and we're done. It should be really a living document, because this is just saying we're going to get it started and off the ground. But from there, we're going to be applying for grant funding. We're going to be working together and seeing where this all goes. It could be something small and humble. It could be something large, but really that just depends on how we work together and how we can make that happen. So yeah, that is mainly what we've done so far, but I also have copies of the coordinated plan if anyone wants to look at it. And there is a comment page on my Facebook page, or not my Facebook, but the website, nwomobility.com. The public's welcome to read. There's a link that they can click and open the coordinated plan. They can also submit comments that way. Yeah, anything that I left out that like my committee members might want to chat about.
Is there a template to follow? Henry County, let's say, for example, we're kind of getting into it pretty good.
Mm-hmm.
Is there a way we can follow their template? Is there something we're missing that they've already done?
It's a great question. So I invited Tracy Bush, he's the EMA director for Henry County, and he is on their board for Henry County Transportation Network and has been for years and helped them write their grant. He's going to come to our next Transportation Coordination Committee meeting and kind of walk us through what it was like for them to go, because they started out 20 years ago with the 5310. I'm going to say a lot of numbers. That's specialized transportation. It's for seniors and individuals with disability. Stop me if I don't remember, just explain things. They started as a 5310 and they ended up switching to a 5311, which is rural public transportation, I think in 2019.
Transition into that.
Yeah. Yeah. And then I also invited for the next meeting, Chris Craves. He's from ODOT and he is the statewide coordinator for the 5311 Rural Transportation Program. Because there's not, the thing about ODOT is, in my interpretation, is that they kind of say, here's a program, we're going to let you kind of decide how you run yours. We're not going to give you like super strict rules. But the challenge with that is then we have to kind of decide what we want to do. The neat thing about transportation funding. It's one of the rare funding opportunities that allow you to braid federal dollars with federal dollars. So Marcia here at the Senior Center is getting Title IIIB funds that help with transportation through the Area Office on Aging. It's technically a federal dollar stream, but we could take that dollar stream and have it as part of the match for the ODOT dollar stream. Same thing goes for our JFS funding. Seniors, JFS, Board of DD. So there's a lot of funding. I always like to point this out. We're already spending money on transportation in all the counties I serve. They're all spending lots of money, but in silos. If they work together, pull their money, ODOT's grant formula grants will give you 50%. So whatever you're making, you could double that in the grant, but that would mean you'd have to work together. And that's challenging. So I think part of this is coming up with a strategic plan of how will we start it, and then through the years, maybe year 4, 5, 6, wrap in another organization, see how that works, makes adjustments, and then another 5 years, wrap in another organization. And the program just continues to expand in serving more populations. But it does take some time, and I don't think it's going to start overnight. It's definitely going to take a lot of coordination in my views of it.
The original funding in the state, how long will they fund this? Like a one-shot deal or?
No, ODOT, it's a formula grant that they get through the federal government,
Okay.
and they've been getting it the last 20 years.
Oh, wow.
Yeah.
But
No.
I can't remember, like we was in vehicles.
Mm-hmm.
So if it was for funds for transportation itself, do you have to reapply every year?
Yeah.
So yeah.
ODOT did make an announcement at their last meeting with mobility managers that next year they're going to change it to a 2-year cycle, but all this way up until next year, it's 1-year cycles. So. And the other thing is that's just operational expenses. You can also apply for vehicle expenses. And if you wanted to purchase a vehicle, ODOT will pay 80% and the local match would be 20%. Yeah.
And I was telling her years ago, they used to be called Section 16B2s and through NOCAC and we would apply for them. We got 2 vehicles from them over the years, but the last one I applied for was probably 2005 or 6.
Yeah.
And if you cannot show coordinated efforts, that you don't score high enough to like get the vehicles. You could be doing the exact same thing you've always done, but if you can't show that coordinated effort, and that's where
this coordinated plan is huge.
I mean, at that time, they were doing phoner ride yet, and so like we would, I listed you all as like a coordinated effort. If I couldn't get somebody, they would refer them to the Paulding Hospital, and I put down coordinated efforts that if I couldn't cover something that they were on Medicaid, I could, of course, Jobs and Family didn't contract with KMP at that
Back
time.
then.
They had, their own staff doing, but so I was able to do that, but it still wasn't enough.
Right. Well, when you ask about a template, this is literally, the coordinated plan is literally a template ODOT gives me. So yeah, sure. ODOT, so they gave us a template for this format of like, these are the things we want you to research. These are the things we want you to look at. They don't give us a template of how to solve the unmet needs, but they give you a template. They give you a template for how to research it. Yeah. Great question. And I've been doing a lot of research on like regional transportation authorities for Henry County right now, and what have other counties done. So while we don't necessarily have a roadmap to tell us exactly what to do. I think there's some wisdom in interviewing other counties who have transportation systems and learning the strengths and weaknesses of them. So that way you kind of learn from their process and what they've learned over the years. So you don't have to make those same learning mistakes. And a lot of counties across the state have transportation systems, and some, it's not countywide, it's maybe the area office on aging is running it, or the equivalent of NOCAC is running it. So everybody's running different transit systems. It doesn't have to be county run by any means.
And NOCAC was doing the, what was it called?
Find or
Fast, what did they have? And they chose not to continue that. Do we know why?
it was a grant funded position while the bridge was out in Defiance, the
Yes.
that's not the
What would
name
they
of it.
call it?
Something a ride. But while the bridge was out,
Find a ride.
Some dial ride.
dial a ride maybe.
Dial a ride was the Paulding Hospital.
Well, but they did do it. They had a grant. And what was good about that grant is, one, the bridge was out and it showed how many people actually do walk across that bridge and need that transit system. But I think it also was a really good demonstration of because 90% of the population in our area have vehicles and are driving themselves. But for that 5% that doesn't, it's pretty hard to get anywhere. So I think that showed a lot of our around, like officials around here, that there is a need for the non-driving individuals. Yeah. And if you want to look at other models south of us in Paulding County, Lima, all of them, they work through their area office on aging, and they have a dial ride where they have like a call center that then brokers rides out to providers who are part of that brokerage system.
Just certain times of the day or 24 hours or?
I think they try to they like, you call in and you tell me your name, your age, and I'll ask you a bunch of questions, and I'll try to figure out if you qualify for a certain app funding stream. And if you don't, then they will try to find a for-profit business that would offer you a ride and then help you schedule that ride.
What
So
did you say had that?
the area office on aging 3,
Oh,
Region 3.
Oh.
Their mobility manager is actually housed in their area office of aging. And they do that call center essentially. So that's an interesting model, but that's more of a regional approach versus a single county approach. So yeah.
No, like right now, this is the public comment time, so
Mhm.
you have like a monitoring system, how many people have commented, gotten much response?
I think I have had 4 so far.
Are they from like lay people, are they from like organizations like Ron and Marcia?
Their organizations could totally, but right now I only have one organization who replied. Most of it's just from common people across the
Can you
county.
share with us what some of the comments have been so far?
Oh, you're testing me. They're long. It's a lot of times it's a lot of questions. It's not just like someone asked, does this mean there would be taxes? And while transportation can lead to taxes, that's not where we're at in our discussion at all. Somebody else asked about, would this help with sidewalks and bike trails? And I said it could, because I know with some of my other counties, I've been doing TAP grants for them, Transportation Alternative Program grants, which is another ODOT funding stream for sidewalks. I don't remember off the top of my head, but what I will do is at the end of July, I'll make a document with all the comments and I'll give it to the committee. And then the committee can kind of say, oh, that's a good comment. Maybe we should edit something, or they just take it into consideration.
Do you respond to each of the comments right afterwards, or is this just like your thoughts on how you?
Well, one person was a private message on Facebook to this event tonight. And so I did respond to her and try to answer her questions. But sometimes people will put a comment in and not leave a name or number or any way to contact them, so I can't. It's just a message for the committee then.
And that's on your website.
Mm-hmm.
You can go
Yep. Yep. And I have a link on our Facebook page, on the Facebook page too. Yep.
Do you think it would be advantageous for those that aren't on the committee to find out like what some of our surveys were, the survey results?
Sure.
Because we found out that one of the higher, do you mind if I talk?
Go ahead.
We did find out some of the higher needs are the people under 60 that need transportation to medical appointments or to work. They don't fall into the disability issue, and they don't fall into this, a senior issue. So they're that kind of that unfortunate lost group. And
Mhm.
that's where some of our, right,
Yep.
that's where some of our higher numbers were, but. And I know somebody tried to get an Uber started here years ago, about 3 years ago, and it was not working out well at all with his vehicle insurance. So he did not pursue it.
We looked at disability populations, and just because you're disabled doesn't mean you can't drive yourself, but some cannot. And I do know that that's a challenge with pretty much all over Board of DDs. They struggle with finding rides to work. So I can get a job at Wendy's or McDonald's, but I don't have someone who can drive me all the time. And so I end up losing my job and not being able to go to that job. So I think that, and when I look, I know I'm talking about other counties. Sorry, I'm supposed to be focused on Paulding. But last summer, I met with the superintendents of the Board of DDs of Defiance, Fulton, Henry, and Williams. And what we saw was that Henry County is the only one with public transit. And their number of individuals with DD who work is like almost double all the other counties. And they're like a 10,000 population smaller than the other counties. And it's just because those individuals have access to transportation so they can work. And that makes sense. I think looking at the poverty level as well, when I talk with JFS and KMP Medical, JFS will give rides to people who are on Medicaid to medical appointments, and that's great. That works really nicely. But that same population needs help getting to work, getting to the grocery store, social outings. So while we see that population being taken care of for transportation for medical needs, maybe not other needs. And so we see that as a definite need. Sorry. Trying to think of other things that we identified as needs. Getting to work, especially on second and third shifts, it's something that we just don't have the capacity to do right now. And the thing that Paulding struggles with, unlike many of my other counties, is they don't have a taxi service. So even if I wanted to pay for someone to help me get somewhere, I don't have that. And then also I know the Adams Board doesn't necessarily serve Paulding County, but when we talk about mental health, the isolation of people suffering from mental health issues, being able to actually get out and go visit their friends and family, that helps a lot. Being able to go to the grocery store on their own and not being in need of others, that helps a lot. So I think you'll see across the board lots of pockets of population. Again, I want to emphasize it's not an overwhelming need, because when we look at households with 0 vehicles in them, according to the US Census data, it's like 4.8%. It's under 5%. So it's not a huge population, but for the population that is in need, it's a life-altering thing for them out here.
And I've shared at some of the committee meetings, like we have people that'll call us often that are under 60 and need to go to a medical appointment. And like I work with PASS, the Paulding Association. Is it Paulding Association of Social Services? It's the old Easter Seals, but Judy Fisher and then manage that.
Mhm.
And I can get coverage from them. So like they contract with me. And so if I've got a person that's 57 and needing to be someplace, let's say they're in a wheelchair, so that's why the family can't take them. It's usually because they're in a wheelchair.
Mhm.
Then they'll reimburse us to go. So but there's still that lost pot
Yeah.
that, so we can't do socialization unless it involves, an education trip, like to Sodders, that's education. But if we do even a socialization trip to a restaurant to go see Christmas lights, the people have to pay a fee. It can't be covered under its federal dollars. So the whole socialization pockets is really hard to.
Yeah.
Employment, we don't get reimbursed for employment.
Mm-mm.
So no matter what age.
Oh, really? That's too bad.
Employment thing. No.
Question, as you're talking about this program though, if we would set something up, when people call in to use it, it is just not a guarantee though, you can get it right though, they have to meet criteria, is what I hear you saying.
It depends on how we set it up as a county. Yep. So if we set it up as a 5311, which is the rural public transit, then as long as it's within the out, like, we're allowed to say we're only going to serve Monday through Friday through these hours, or we could say we're going to serve 24 hours, 7 days a week. But as long as we set that and it's a stipulation for everyone, anyone off the street could call us and ask for a ride, and they would get a ride as long as they're willing to pay for the service.
Okay, so there would be a fee.
Yeah. Well, okay, so that you're asking me models out there. Like right now, Henry County Transportation Network charges you $2 for anywhere inside of Napoleon. There are some rural public agencies have chosen to not have a fee and it's just a free ride. But with them, they either have a foundation or they have industry in the community willing to donate to that and things like that. I went to a presentation where they showed how they're actually saving money by not charging $1 or $2 because the small amount of money revenue they actually bring in doesn't even pay for the accountants they have to pay.
I'll bet.
You know what I'm saying? So I want to say that I know Henry County does charge a fee for $2. That doesn't mean that Paulding would have to, but it would be a decision that you'd all have to come to and find. ODOT wants to see that you're sustainable. So if you can't find a way to make sure that there's going to be sustainable funds, then they wouldn't support that decision.
But under the rural, there would not be the different categories of people that may or may not be have access to it, because in theory, anybody who lives in this county should be rural.
If they are.
Yeah, yeah,
That's good to know.
yeah. So, but what they'll do, what Henry County will do is they'll ask you questions. And if they see that you qualify, if you're over 60, they know that the senior center will kick in $2 for your trip. That way they're not charging the individual, they're charging the senior center. But that's because Henry County's made a contract agreement with the senior center that says we'll cover X amount of rides or X amount of miles. And that's how they figure that out. But they would only be able to cover it if it was under that contract. Otherwise, that individual would have to pay that $2
Sure.
in their model.
And I believe they get their money to do that from applying for 3B funds.
Yeah.
They have a small pocket of threes like we do. And they use that, I think, to pay
Mhm.
how they do theirs.
And that's a matching fund.
And actually, our 3B is changing. They're gonna go to a sliding fee scale for transportation.
Oh, really? Interesting.
What percentage of Henry County riders are subsidized through programs versus having to pay the $2?
You know, I don't know that number, but I think a high percentage of people who ride are riding because they are either a senior or individual DD and qualify for DD waivers. I've done a couple of ride-alongs with them where I've like rode on the bus and got to experience and talk to people, and that's the populations I mainly saw, but I don't know the percentage for you.
What was your question again, Adam? I'm sorry.
What percentage of people in Henry County actually have to pay the $2
I didn't-
versus
okay, I didn't hear
are
what you said.
being covered by some other
Yeah,
program?
I couldn't tell you off the top of my head.
Okay.
I mean, even ours is a suggested donation, you know?
Yeah.
But yeah, the last word we had from ODA is they were gonna start doing a sliding fee scale for transportation.
Okay,
So I'm supposed to give it the area office in August to.
understand
It was
those
supposed to
rules.
be effective April something, and so when I questioned it, they didn't even have the information on it yet.
Mhm.
So.
Okay. If you have more questions like that, or if I can look into, like, if you want to know that number, I can reach out to Tom Stuckey, their interim director, and try to figure that out for you.
It's not a huge issue. I
It's
was
just wondering.
like,
Yeah. Yeah, because
it
my,
kind of helps you figure out what that unmet need is.
yeah, I see what you're saying. Yeah. But that's pretty much it. I guess my big ask for the end of this evening is please feel free, electronically, or if you'd like a paper copy of the coordinated plan, I've made 5 copies for you. And this looks like we came out just that much, but feel free to have people take it, read it, give us their comments. If they have ideas or if they've seen things that have worked in other counties, maybe they were visiting family or something, we'll take that feedback. Because right now we're still kind of in the discovery phases. I think that's fair to say.
Did you come with like possibilities of doing something with the hospital with that? Or-
I came here to more or less listen because the number of people that we have to get rides from the hospital back home, most of them people ride via EMS or via the police.
Right, and then, yeah, and if I can't go, I mean, we take several of them home, they'll call me and ask me if the person's over 60.
But if not,
But if they're not, then, yeah,
Not, most often we'll have to call Ken.
yeah, and they come from Defiant.
yeah, that's pricey.
Last week's,
I have,
it was a waste of home.
I have a question. Do you know of any counties that, just as I randomly think, it seems like school districts have like a lot of unused capacity in their vehicles because they're
Yeah.
only using it peak times when they're taking the kids to school and from school. Many of them have like at least one wheelchair accessible bus,
Mhm.
and things like that. Are there any that partner with school districts to work something where they utilize, at the very least, utilize their vehicle during those off peak?
Yes,
Yeah.
not in Ohio that I know of, but they had an article recently, I think it was Wisconsin or it was somewhere in the Midwest area around us where their rural transportation was using school buses. And I think that's a possibility if a school district was willing to, one, share a driver, huge, share a bus. Vehicle sharing is also something that could be, I think, a low-hanging fruit, especially for vehicles that are sitting and not being used. Could I pay you?
Oh, I thought that was.
I thought that was a cat. I don't know why that scared me, but
You tell my wife is a cat lover.
Yeah.
Charlie's cat's over here all the time. I'm like, oh, the stupid cat got it.
but that, I think that's a creative resolution that some people could take advantage of. Definitely.
Yeah, the only snag we have there with that is like, like we're underneath County Corsa,
Right.
PC Workshop is now privatized. So
Mhm.
like, I don't know that the county would approve them to drive our buses or our vans or vice versa. It's a catch-20.
Yeah, sure.
Yeah.
Yeah.
It's
I
a
don't know.
catch-20.
Sorry, I'm a nerd. I coordinate the document repository for the mobility managers in Ohio because I'm on like a committee. And so I've been collecting vehicle sharing contracts that like the national RTAP, which is Rural Transportation Alternative Planning, Mobility Managers, National Center for Mobility Managers has a contract or not a contract, but like a MOU. So there are contracts and MOUs out there that people are using for this vehicle sharing model. And that's an interesting model. But there are some hurdles because like she said, if she got her vehicle through Area Office on Aging, they may say, okay, we gave you this vehicle. You're not allowed to use it for anyone other than who we consider seniors. So we'd have to definitely look at where are your funding streams coming for? Do you have any limitations to sharing vehicles and using other vehicles?
Getting vehicles to the area office, that's a myth.
Oh, sorry. Okay.
It used to.
It used to be a thing.
It used to be.
Well, you know what I think of is veterans have very strict rules on if you use DAV vehicles. That's very strict rules on the DAV
Well, what
vehicles.
made me think about it is
Yeah.
I remember reading about a city in North Carolina that said, look, there are pockets of the areas that are not getting Wi-Fi coverage.
Yeah.
So what they did is they outfitted all the school buses with Wi-Fi, major Wi-Fi routers. And then they figured out where to park them during the day to get the
Wow.
greatest amount of coverage within the village. So that when they're not, no, but I mean, so when they're not running kids to and from school.
We park
they
it here.
Them so that they can provide Wi-Fi service.
Neat. So
in a
neat.
hotspot
We don't need
to
to
the
get
greatest
broadband,
area.
just get buses out there.
Yeah, they just have a cable on a reel behind one of the crosses and just reel it up when
But
you're.
But anyways, I mean, those kind of figuring out what resources you can
Yeah.
combine where there's unused capacity,
Yeah.
just.
So like I did a ride along with Henry County. And in the morning, we picked up the individuals with DD who were going to either day centers or work. And then we went to pick up the seniors and took them to the senior center. We took a nice lunch break, went and picked up the seniors from the senior center, took them home. Then we went to the work locations, picked up the individuals with DD. That bus was constantly running is what I'm trying to get at. And versus if we had siloed systems that just took care of individuals with DD and just took care of seniors, then we have Just a little pocket of the day we're serving them, and then the rest of the day, maybe the bus sits there. Or maybe the bus is utilized in a different way. But that's kind of the mentality, is how can we get more bang for our buck with the vehicles we have versus each having to have their own set of vehicles, own set of rules, et cetera, et cetera.
Now, when you say bus, you would be a big long school bus, or do you mean a shorter bus?
No, they have a.
Henry County, it's kind of like, I think what you have, Yeah. and then you have, it has a gate for a wheelchair.
Right, right.
Yeah,
Yeah, that's what I meant, is those
shorter buses.
shorter buses that accommodate the DD.
Which is interesting because I just talked to someone from NOCAC maybe 2 weeks ago, and the Head Start buses are actually, that funding's able to braid with the ODOT dollars. So that's an opportunity there. I'm not telling you what you guys have to do. I'm just, here are some of the things I'm seeing across the country or part of our state. Maybe it's something that might work for you.
So if you guys are ever at Walmart, and there's like 3 or 4 people with disabilities that work at Walmart, those are all brought in by Henry County Transit. And you'll see them out there on a Sunday night at 10 o'clock picking them up to take them home.
Yeah.
I mean, they're running lots of hours to provide that.
And they're probably individuals who have transportation waivers through their board of DD. It's not like that individual is paying for Henry County to come out. So, yeah, it's just learning where the pockets of money are and how we can work together. Am I overwhelming the new folks? It's okay. All right, well, thank you again. And if you haven't signed in, please make sure you. ODOT likes me to report back to them.
Right.
Okay. Stop recording.